Good afternoon, everybody. This is David Skok speaking, the founder and CEO of The Logic. I am going to talk very slowly as we bring more of you into the call, and then we'll just wait a minute before I introduce our guests today. So if you're just joining us, I'd ask that you stay on mute so that we don't have your feedback yet. And we'll get everybody in, and then we'll start the call in about 60 seconds. All right. Good afternoon, everybody. As I said, I'm David Skok, the founder and CEO of The Logic, and I'm joined today by Helen Branswell, the infectious disease reporter for STAT, and Kevin Carmichael, national business columnist for the Financial Post. I don't really need to get into much of an intro for today's conference call because you're all here because, like us, you're thinking about some of the immense upheaval happening in the world with regards to COVID-19, which some experts, including one of them on the call today, are calling the most daunting virus in half a century. And of course, we had an earlier shock on late Sunday night into early Monday morning with the price of oil going down and the implications that can have. So before we get started, I just thought it'd be good to give you guys a sense of the experience and how lucky we are to have these two joining us. Helen, welcome from Boston. I'm wondering if you could quickly just, tell us a little about who you are, welcome and your experience in covering these types of things.
Okay, so I'm Canadian. I used to work for many, many years for the Canadian Press. I was based in Toronto during the SARS outbreak, and that was really my introduction to infectious disease outbreaks and the damage they can cause. Since then, I have, actually for the last 20 years, I've been writing about health. And since the SARS outbreak in Toronto, really focusing on infectious diseases. And about 4.5 years ago, I moved to Boston to join STAT, where, my focus is exclusively infectious diseases. I'm really up to my eyeballs right now. This is really, I've written about a bunch of these things. This is the big one.
Okay, we're going to cover that a bit more. Kevin, just a quick intro as to who you are and what you cover.
Sure. Kevin Carmichael, national business columnist for Financial Post. I have typed for the Globe and Mail, Bloomberg, CP as well over the last couple of decades. I did a lot of that typing through the last sort of global financial crisis a decade or so ago. I make the joke that my C, R, I, and S keys have essentially worn out. It doesn't, in some ways, I don't feel like I've stopped typing about financial crises, and now it looks like gearing up to write about another one. So I'm looking forward to talking with you all today.
Great. And Kevin, we got a little bit of feedback on your mic there, so I'm wondering if you could maybe go a little bit further away from where you are, and it may help. So Helen, why don't we start with you? Obviously, it's a very fluid situation. What can you tell us the very latest on where we are with the outbreak?
Well, I can't tell you the very latest because I'm here. I'm not on a call that the WHO should be having either now or in a few minutes. They're updating 3 times a week at this point, and the one for today was scheduled for the same time as this. I'm waiting to see if they're going to declare this a pandemic. They leaned very heavily into the fact that that call would be coming soon on Monday when they briefed. It really felt like they were trying to get people ready for the notion, although I believe the public is already there. I think it's been clear for a while that this is not stopping and likely going to continue around the globe.
What is the nomenclature around pandemic versus not using it? What are the implications of that?
They're not clear. Typically, the word pandemic is used for influenza, and that's a flu pandemic is when a new strain of flu that people aren't immune to emerges and sweeps around the globe very fast and infects a lot of people. In this case, it's a coronavirus, but many of the same criteria apply. This is a virus to which humans don't have immunity, and so the expectation would be that we're all pretty much vulnerable to it, and that it will sweep around the world looking for people to infect. And it's not like a magic thing that when you declare a pandemic, certain things get activated. It might have implications in the insurance industry that I don't know, but it won't change a ton. I know WHO has been worried about using it because they fear countries will throw up their hands and say, so it's a pandemic, there's nothing we can do to stop it, we just have to deal with it. And they are very much of the mindset that if you don't try to beat back numbers, your health systems will be completely overwhelmed.
So forgive the ignorance, but it's not as if by declaring it a pandemic, there's automatically a shutdown of all airports, border crossings, or any sort of, lock in place kind of things that happen.
No, I don't think so. I mean, individual countries may have some kinds of laws about that, but I think they typically would have been about flu pandemics. In the 2009 H1N1 flu pandemic, a lot of countries had contracts with vaccine manufacturers to make a pandemic vaccine when a pandemic occurred, and those were activated by the declaration of a pandemic. Countries actually found themselves in the position where they didn't want to buy a vaccine because it didn't seem like it was that serious a pandemic, but the contracts were activated by the call. In this case, that wouldn't apply because there is no vaccine against this virus.
We've been hearing a lot about the U.S. having a shortage of testing kits. Are they catching up? Is the supply now reaching where it needs to go? And in the Canadian context, I'm not sure how much you've been looking at Canada, but how are we faring in our capacity to try to stay in front of this as much as possible?
Maybe Kevin knows about the Canadian capacity. I have not been able to keep my eye on that. There's so much going on. In terms of the American situation, it's a fiasco. It's a disaster. The CDC, which would, in any case like this, when a new virus emerges, the Centers for Disease Control and Prevention are the people who would develop a new test. If a health emergency is declared, only tests that have emergency use authorizations from the FDA can be used. That's what happened here. The CDC test turned out to be too complicated. A lot of state and local labs started trying to use it and were getting wrong answers, and the tests had to be pulled back from most of them. As a consequence, for weeks now, no one's had any kind of a picture of how much virus is spreading in the country. The assumption is a lot more than is seen, but it's not, those labs are only starting to test now and not at, high numbers. Apparently it's also a low throughput test, so you can't run very many in a day. And just laterally, we're all discovering that one of the companies that makes reagents for RNA extraction, which is a process that you have to do before you can run the test, they're running out of supplies. So not only is the problem not solved, it's not going to be solved soon.
Okay. By the way, if you have questions, here's your chance to ask the experts. So you can enter them in the chat as you're listening, and I'll try to get to as many of them as I can. Kevin, obviously markets have now reacted to all of this. It took a few weeks, surprisingly. I thought there was a little bit in it seemed like the obvious sectors that were most immediately impacted, and then of course last week things started to go in a different direction. What's the mood in the business world?
Sure. I wish I could think of a pithy way to answer that. I mean, obviously the mood is, I mean, there's panic in the markets. It's different from 2008, 2009, where there was like just extreme fear. So everything froze out of fear because nobody understood who was solvent, who wasn't, where there was money, where there was not. So just everything just stopped. This time people are just kind of scared because they realize how bad this could get. But at the same time, there's not always evidence there to suggest that things will be so bad. I've seen lots of market commentary over the last few days, for instance, trying to become experts like Helen as to the trajectory of the virus, and projections about how the cases should taper off by the spring. Therefore, we should be setting out for a V-shaped recovery, that sort of thing. So, yeah. The panic, a bit of confusion, and I suppose there's a minority group out there that are sort of crossing their fingers and thinking they have a buying opportunity now.
And sorry about the audio glitch. It was I will swear to everybody, including Kevin, that he sounded like he was in a podcast studio before we started. Kevin, the supply chain impacts. Initially it was the Chinese ones. Has it expanded beyond that, and what kind of impact are you seeing on the Canadian side in terms of getting stuff to market?
Right. Well, we've been trying to do a bit of work on that at the Post, and it's really tough to find the data. So there's lots of theoretical papers out there, sort of explaining basically how supply chains have expanded over the past few decades, and therefore there should be a big impact now. But we're not seeing it in a lot of data yet. That doesn't mean it's not going to happen. I mean, I think there's every reason to think that we're going to see some supply chain impact. I'll provide a small scale example. There's a maker of electronic snowmobiles here in Montreal that did its sort of official launch last week. And that launch was delayed by about a month because they couldn't get the electronics from their suppliers in China in time to get their that's not going to be the end of the world. It's a small company. These guys aren't going into full-scale production until the fall, so it's just a minor inconvenience, but it was a bit of a wake-up call for them, and so they've spent some time, rejigging their supply chains, looking for what they call redundant suppliers, things like that, ready for when they ramp up production going forward. So in some ways, it's a positive. Also,
Wow.
Well, I was just going to ask what we have a question from Hussein here, walking through the expected cascading effect from the markets to small businesses, and ultimately when it'll start to hurt people and jobs. I don't know if there's probably not a smooth line there, but maybe in reference to 0809, how long was it before the things trickled down ultimately to layoffs?
Sure. Well, in 08 and 09, it was almost immediate. Credit markets seized. So spreads spiked, and so basically nobody. This time is different in that there haven't been extreme spikes in credit prices yet. I think people are anticipating that possibility. They're getting ready for it, but they're not seeing it yet. So, for example, just this morning, so far, very positive, at least here in Canada. So for the moment, things are okay.
Okay, great. Sorry, Kevin, we're going to interrupt. We seem to have lost your audio progressively. I'm wondering if you may want to disconnect and then rejoin again, if you don't mind, and if you try maybe turn off your speakers if that may be the issue. But sorry about that. But if you don't mind giving it a shout, and I'll hang on here with Helen and ask Helen. Uh, you've been covering these things for a long time, and I guess I can hear a little bit of the deep concern in your voice when you're talking about this. How does it compare to what you've seen in the past, as both from a medical perspective of the virus itself, and also from the response and how communities are having to respond to it?
Okay, so well, it's a whole lot huger than anything else I've really written about. SARS was very bad. Anybody who lived in Toronto would remember that, and the damage it did to the hospitality industry, the conference business. I mean, conferences wouldn't go to Toronto, and people wouldn't go to Toronto. Downtown looked like a ghost town. But this is global. And so there are going to be so many knock-on effects. There already are. People are already, the CDC is already sort of urging hospitals to use N95 respirators, those sort of hard domed, we call them masks, but they're not really masks, but the types of things that really keep healthcare workers safe in circumstances like that. They're suggesting that they use them only in certain circumstances and use paper surgical masks in others, because the masks are going to run out, and then you're faced with a situation where healthcare workers will have to choose whether or not they will work. And if they will, if they work and get sick, then we're in even more of a pickle than we already are. So, I mean, in terms of the virus itself, this virus has lots of tricks. It's very good at spreading. It spreads early in an illness, so maybe even before a person knows they're sick, maybe a few hours or a day before somebody really recognizes that they're not feeling well, which means that people are out and about and doing what they do in their normal life, so able to spread people. With SARS, able to spread to other people, excuse me. With SARS, the virus you were most contagious about 5 days or so into your illness, by which point you were probably already in hospital. So it was much easier to contain. It was dangerous for the healthcare workers who were looking after you, but you weren't walking around in the community infecting other people. So, so that's part of the problem. Another part of the problem is that, there appear to be mild cases that aren't coming to light. And that's good in some respects, but in other respects, it means there may be people who are transmitting the virus who just never are spotted. And so, again, it's much harder to know where the virus is. And that's important, because during SARS, if people remember, places like Toronto and Hong Kong and other places used quarantine and isolation to great effect. The world was able effectively to stop the spread of the SARS virus because the dynamics of transmission were such that if you isolated the people who were sick and made sure that the only people who came in contact with them had personal protective equipment on, and if you quarantined the people who'd been exposed to them and to make sure that they weren't sick, and isolated the ones who became sick, that you could break the chains of transmission. And that is not really possible with a virus that's working the way this virus works.
So if you were running a business, Helen, like some of us are, would you, at this point, would you be advising us to have every employee? I know Shopify today announced that they're working remotely for the foreseeable future. Would you advise companies to have all of their employees work from home, or, wait for more cases to come to light?
So, I'm not the right person to be giving advice. People should be taking advice from their public health departments. I will tell you that I am now working from home, and That's both because I'm in a demographic that this virus is unkind to, and also because I can't afford to get sick. I need to work, so I'm working from home. It is very true, I think, now that people need to be thinking about social distancing and be planning. I think, the time to do it is before have a problem. You have a problem. I wrote a story that we published this morning about so-called flattening of the curve, trying to prevent a really explosive outbreak from happening, because those completely overwhelm your healthcare system. One of the people I spoke to, an assistant professor at Harvard's public health school, made the really good point that, we all feel a little bit like maybe we are overreacting right now, and we feel a bit sheepish about it, like when we bump elbows instead of shaking hands. And his point was, this is a time when you can make changes in your behavior, when, the virus isn't clearly all around you, where those changes could have an impact. Once you've got a problem, your ability to impact the speed at which things spread, you've already lost the window to do some of that. So certainly people who can have less contact with people and other people should be thinking about that. I personally would not go to a hockey game now, or a concert, or take unnecessary travel. I mean, it's just a time, I think, to prepare for life not being as usual. It's not going to be life as normal for a while, and we need to get ready for that emotionally, psychologically. People need to ready their kids for that. People need to ready the seniors in their life for that, because they are super vulnerable. And think about ways you can be resilient, increase your chances of being resilient.
Kevin, I see you're back. Thank you for humoring us and rejoining. I'm going to ask you the same question, which is, if you're a CEO, I read a Sequoia Capital note last week that really brought it home for me in terms of how businesses should be thinking about their business over the next 18 months or so. Are you already having conversations with CEOs saying, listen, we need to contain our costs. We need to maybe even make some layoffs. This isn't going to go away?
I haven't heard that yet, at least to that degree. I mean, it sounds like it's something that's totally plausible, which is why my advice to a CEO would be, and this might sound crazy, but at least in the Canadian context, to call your MP. I do think that, I'll say a couple of things here. Now, I think to a degree, it's an echo of what Helen was just talking about. There's, for whatever reason, there's a reluctance from governments, sort of across the gamut of at least rich industrialized countries, to they're holding back, which is puzzling to me, because the lesson from the financial crisis is that you go big, you sort of try to push that panic and that fear out of markets, out of C-suites, sort of as quickly as possible. So it's not like governments are sort of asleep at the switch. I don't think it's not like that, like perhaps they were sort of through 2007 and early 2008. But they're not going at it as hard as they could. But I think the potential for them to do so is there. So I think at this stage, what they need to is to hear from executives about the sort of things that might be happening, so they can design the right sort of policies to offer bridges, sort of to whatever exists on the other side of this calamity. And I think they're just not clear what businesses need. They know it's not like the financial crisis, where you just needed to fight on every front. They can sort of see where the pain is going to come, but they don't know exactly what might be happening on the ground. So if they start to hear what's happening from the ground, they might be in a position to design sort of appropriate backstops to get smaller companies, startups, whatever, sort of through this period.
How much wiggle room does the government have, Kevin, in terms of its fiscal? How much in its war chest does it have to be able to throw at this?
Sure. Well, it depends on the government, of course, but the Canadian government has all kinds of wiggle room. So I know that there's the one particular opposition party would have us believe that we're on the brink of bankruptcy, and I get it if you're of the mind that you think that a government should have a balanced budget basically at all times. But we're living in a world where money is basically free, at least for a AAA rated government like Canada. So if the situation is bad enough, the government can borrow all it needs to sort of to push us through this. But that's not even necessarily an issue for Canada at this stage. The deficit is 1% of GDP. That's nothing in the larger scheme of things. Debt to GDP ratio is around 30%. That's really nothing, certainly relative to all the other rich world countries. So the government has the scope to do whatever is necessary. So I think they're just at a stage right now where they're figuring out just how much is necessary. So this morning, the Canadian government announced that it's going to put up $1 billion immediately for the provinces to sort of deal with the frontline health issues, some research development, that sort of thing. That's positive, but they so far haven't said in such detailed terms about what they're ready to do to sort of prop up the economy. I mean, I think that's going to come, but they just haven't told us yet. So anyway, the bottom line answer to your question is Canada has lots of scope. Countries like Italy, a lot less scope, which is perhaps somewhat troubling for the global economy, and certainly Europe. That sort of the epicenter of the virus there is a country that's is arguably on the brink of bankruptcy before any of this happened. So it depends where you are, but in the Canadian context, we're fine.
Helen, one more question for you, and then I suspect there's another WHO briefing.
Oh, by the way, no, they declared a pandemic.
Oh, they did? Okay, well, there you go. Breaking news on your subscriber conference call. So there is a pandemic. Helen, I guess, well, that was kind of one of my questions was, over the next few weeks, what should we be looking out for as we keep reading your coverage on STAT, as we keep listening to this stuff? What are kind of, what I don't know how much further we can go here in terms of triggers for cause for concern, but what are you going, let me reframe that. What are you going to be looking out for in the next couple of weeks to get a sense of where this is going to go?
So, I've been watching what's been happening in China and South Korea. Both of those places have managed with pretty draconian measures to drive down their numbers really, really low. I mean, but the WHO has been saying that this can be done and countries should try to do it. It's hard to imagine that many countries could do what China or even South Korea could do, and they also had, while it was a disadvantage to be hit early by this virus, they had the advantage of being hit early in the sense of they were able to snap up a lot of supplies that are no longer available to countries. So, N95 respirators are in very short supply. Assays for testing are in very short supply. So, that's going to be an issue going forward. One of the things, if I could, I'm sort of go on. One of the things I'm also going to be looking at is blood tests that look for antibodies in the blood of people who weren't identified as cases, but maybe were around cases, lived in a community where the virus was spreading. I mean, the big hope all along here is that we've been missing a portion of the cases, so that when you try to calculate what the mortality rate from this is, that it's going to turn out to be a lot lower than it is. It's not going to be a walk in the park under any circumstances, but once somebody starts doing that kind of study, we may find out that the fatality rate isn't like 1 or 2 or 3%, but maybe 0.5%. 0.5% would still be awful. We have a rough ride ahead of us, but it would be a lot better than 3.
Yeah, and 0.5, I mean, the flu is. So it still is 5 times what the flu would be. Okay, Kevin and Helen, if you have to jump off, by all means, please do. We're so grateful for your time. Kevin, one more question for you. When we lost your answer to the question about the trickle down effects and how soon we could start to feel those. Hussein wanted to hear the answer to that question. We cut out before there. So if you could repeat your answer to the question of how long we should start to see the trickle down impacts of this start to hit Canadians, what are we looking at?
No, of course. The financial crisis, the trickle down effects were almost immediate, right? The credit market seized, spread spiked, and nobody could get any money. Apparently, I haven't looked at numbers this morning myself, but the finance minister did say this morning, when the government was making that $1 billion announcement that I just mentioned, that he's in contact with the banks daily, and they so far have reported no serious issues in credit conditions. So that could change if the trajectory of the spread of the virus changes, and we get some bad news and another panic like we saw on Monday in financial markets. That could be tough, but generally speaking, I guess things are, I'm sure, tougher than they were maybe 3 or 4 weeks ago, but maybe not anywhere near a crisis phase yet. I haven't seen details, and I don't know that there are any details to be had at this stage, but the government, the finance minister and the prime minister did mention this morning that they are marshalling the various Crown lending agencies, as they did in the financial crisis, to be ready to offer up bridge loans, backstops, that sort of thing. So it does look like they're dusting off the financial crisis playbook, I guess, and getting some of those sorts of measures in place. That should be helpful. It should be very helpful, actually. Some of those programs work quite well once they got them going during the financial crisis. So if you're a Canadian company and have access to EDC or BDC or any of these agencies, or have relationships there, and you can show that you're being hurt by what's going on, in relation to the coronavirus, then there's a good chance that you can at least get a government or federal government backstop to get you through a temporary rough patch.
Wow. All right. Thank you, Kevin, for joining us. I saw a question here from Stuart just regarding how the media is viewing its role in protecting the public. And before we conclude here, I just want to say that we obviously been taking this very seriously and view our role at The Logic as a place to really be an indispensable part of your of helping you navigate through this crisis. That is the mandate that we have given to our reporting team. And in fact, we have moved one of our reporters onto the impact of COVID-19 full-time. So one of our reporters will be covering this day in and day out. And you'll start to see more in our daily briefings on it. And really not in an alarmist way, but in a way that we can keep you informed and help you make smart decisions. Certainly like the one Kevin just pointed out about, maybe going to BDC or elsewhere for backstop loans. We're going to stay on this, and we thank you for joining us. Kevin, thanks again for joining us. And Helen, thank you for joining us. And if you have any questions, thoughts, concerns, or stories, or things that you want to let us know, please do send me an email at david@thelogic.co. That's all for now. Thank you so much for joining us.